I'm Kerri Hall. I am the Director of Business Development and Compliance for Billing Specialists Incorporated. We are a family-owned business, and we've been in business for over 30 years. And we are a billing company from Arkansas and nestled in between two lakes. So we're a small company, but with a big heart, and we've done a lot of different specialties over the years, and we are a wide, just a wide variety of work every day. Probably the main specialties would be radiology, family practice, anesthesia, therapy practices also, pathology, pain management.
I'm Stephanie Maddox, and I am an account manager at Billing Specialists, and I am the manager of several different accounts and different account types. Typical day for me in ImagineSoftware is that's where I spend most of my day. It's the first thing that I pull up every morning and one of the last things that I close every day. It's where I post my payments. I do answer phone calls from patients still, and so you'll find me an account inquiry looking at balances that they owe or telling them why they have a balance. I use a lot of the retro payments and all of the ticklers and the exceptions, and so on a typical day you'll probably find me getting into just about everything.
Our biggest challenge was probably what a lot of people were facing was we didn't have a lot of automation. And we were looking to try to save on FTEs. We were trying to save time and, of course, money. But we also wanted to make things easier for our staff. We wanted to try to improve our reporting. We wanted to try to also kind of cut down on just the day-to-day challenges of the time that it took to do the very basic things. So we were really looking for a software solution that was going to help us do that. And Imagine really has come through. We've been extremely happy with those things. As far as improvements from where we were before, we have cut back on some of those basic FTEs as far as paper consumption, just consumption in general, time, employees, but also our ability to meet our clients where they need to be met, as far as giving them the reports they need, as far as being able to tailor everything to their needs. That's one of the things that we try to do for everyone. When you are a billing company, you need to be able to meet your client where they are. And when you have a lot of different specialties, they have a lot of different needs. And we've been able to do that where we couldn't before. We were selecting our new software when we were looking at implementing. One of the biggest things, we were looking for automation. We were looking to save time, to save money. I think that's what everybody does. We wanted to be mindful of resources, from people to paper to everything, to storage. We wanted to be able to reduce consumption, and we wanted to be able to give our clients what they needed. And one of the things that I kept saying to everyone, say it with me, people, automation. And everybody got so tired of hearing it, but it was how we needed to get excited about it. And we needed to understand that it was the future, was not what we had really before, but it was what we needed. And it has turned out to be one of the best things that we ever did, was to embrace that automation. I don't think that we could look back and say, oh, I wish we hadn't done that. Oh, I think that automation has been a negative at all. I don't think there's any of that.
Not at all.
So I've had the opportunity to talk to several companies, billing companies that were looking, and just even regular clinic companies that were looking to implement a new billing software. And I have told all of them that I've talked to that, they need to look at what is important to them, and that if automation is something that they are looking to embrace, if reporting is something that they really are needing, if they are trying to save money, yes, you're going to get what you pay for, but when you look at the things that you're going to be able to do and be willing to go, oh, okay, this is how we've always done it, but maybe how we've always done it wasn't the most effective way to do it, and be willing to make those changes, then you need to look at Imagine, and you need to seriously consider Imagine. I tell them, yeah, it's a process and it's a lot of work, but you truly won't regret it. And that, yes, I'm sure there are other ones out there that might do the basic, but if you want to be able to have all the bells and whistles and be happy with the results, then yeah, do it. Just embrace it.